right side low back pain and left side leg pain. What's going on? Welcome to today's episode of Ask Dr. Walter Salubro. This is where I upload a video each and every day and I answer one of the questions, maybe 2 or 3 questions from the comment section that you leave under my videos. So in today's episode, this is by Preetha, and this is what Preetha asks. It's a great question. I have right side low back pain and left side leg pain from thigh to toe. Is it okay? Is right back pain radiate to left leg? Or does right back pain radiate to left leg? That's a great question, and it can be a little confusing if that's been your experience, or in this case, this viewer's experience. So it is possible to have back pain on the right side and also leg pain on the left side. And even though the source of pain is generally from the same region, most likely the lower back region, the actual tissues involved may be unrelated, okay? So if there's right side low back pain, that can be from a variety of different tissues. It can be from the joint capsule ligaments, it can be from the muscles on that side, it can be from other tissues, maybe like the sacroiliac joint and the supporting ligament structures around there on the one side, the right side. And if there is pain radiating down the opposite leg, so in this case the left leg, that may just mean that there could be a nerve compression or nerve irritation on the left side of the lower spine that goes into the left leg, okay? So it's very important not to focus on the symptomatology as much in terms of where it is and where it's going. It's really up to the practitioner, like a chiropractor, physiotherapist, specialist, doctor, to do their examination and rule out the different situations that could be going on, to do their neurologic checks, their range of motion checks, any testing like orthopedic testing, to do x-rays and posture, palpation by hand, and then we can isolate where the source of the pain and the source of the inflammation is by doing these checks. And as well, if there's other tests like imaging tests like MRIs, that gives more indication if there's other injuries going on like a disc bulge, okay? So in this case, without doing an examination, this is just my thoughts, okay, because you need an examination to kind of figure this out, and also a history and consultation and case review, but it's possible that there can be some tissues that are irritated on the right side of the spine and sacrum region that are causing local back pain, and then there can be something else going on like a disc bulge on the opposite side of the same area of the spine that's irritating or compressing the nerves that are radiating into the actual leg and foot, okay? So this is something that is possible, and I know it's a little confusing and frustrating if that's been, someone's experience. At the same time, the question was, is this okay, right? So in other words, is this normal? Well, it's not so much if it's normal. I mean, it's not normal to have leg pain and back pain. I guess the question is this something that should be expected? It can happen sometimes. It's not normal per se, but it is common, and we do see this happen sometimes. And that's the importance, that stresses why it's important to have an evaluation of the spine, to have a proper examination. Any testing that's required, like x-rays and MRIs, should be done so the practitioner can rule out exactly what may not be happening and then rule in exactly what is happening, okay? Hope you found that useful in today's episode of Ask Dr. Walter Salubro. And again, tomorrow there'll be another episode, another question, and if you want your question featured in one of these videos, comment below, ask a question, and it may be next. If you've missed any of their episodes, go right here, right now to catch those episodes in the playlist. And if you like this, do subscribe so you catch this on a daily basis, as well as my other long form content videos that I put on a weekly basis.